Good afternoon. I want to take a moment to address the false and misleading comments that Governor Hogan made about vaccine distribution and COVID relief funds in Baltimore City during his press conference this afternoon. I want to be very explicit in this response because we will not allow misinformation to distract us from the most critical challenge we are facing at this moment, a need for equitable vaccine supply. First, regarding the allegations, Governor Hogan said, and I quote, "At their request, we transferred 30 times doses away from the health department out to other providers because they weren't utilizing them and we thought other providers could get them into the community." This is categorically untrue. I personally asked the governor for permission to transfer doses to hospital partners to support the equitable and non-hospital partners to support the equitable and rapid vaccination of Baltimore City residents, a permission that he granted. The health department has requested transfers to our partners to expand our capacity to specifically vaccinate Baltimore City residents, older adults, educators, people experiencing homelessness at our own direction due to the inequity of the state's online-only PrepMod registration system. The state continues not to count doses used in this way, which makes it look as if our through output is much lower than it actually is. A third direct quote from the governor during his presser: "We also tried to send $8.8 million to the city to try to help them with their vaccine equity effort, which they turned down." The governor is aware that this is false, but continues to repeat it. The city declined funding from the State Department of Health in favor of using our existing processes to obtain the same funds directly from the federal government. Why would we accept funds using the state as a pass-through when we can continue to apply for 100% reimbursement directly from the federal government as we had throughout this pandemic? These details were communicated to the Maryland Department of Health on February 21st. And at this time, I'd like to offer our health commissioner an opportunity to say a few words on this issue.
Thank you, Mayor Scott. As Mayor Scott said, Baltimore City Health Department has never refused or rejected or returned doses. The city has transferred and reallocated doses to clinical partners to create additional access points that don't require our residents to use PrepMod to self-register. We appreciate how our clinical partners have stepped up to help with these efforts. These vaccines have been distributed directly to support the vaccination of older adults off the city's registry, which now has over 20,000 older adults, individuals in congregate settings, such as those experiencing homelessness, our city educators, and older adults via our mobile vaccination teams. The channels listed above have a common thread. They allow us to directly vaccinate target populations without forcing residents to enter into a Hunger Games-style competition through the state's PrepMod system and the maze of additional registration and interest forms found across different healthcare systems and created by community groups. It allows us to ensure our doses are going to city residents who are eligible but that have been left behind by the state's rollout to date. Moreover, as Mayor Scott mentioned, the city asked for and received explicit permission to transfer those doses in this manner. These types of innovative partnerships via our mobile vaccination clinics, for example, to get vaccines where it's needed most, were encouraged by the state. Through yesterday's clinics, we have provided nearly 1,000 first doses of vaccine to older adults in senior housing and residents experiencing homelessness across 12 mobile events, and we're prepared to continue scaling up and expanding this effort as more vaccines are delivered. We knew from day one that vaccinating our residents would be a collaborative process. To hear this categorized as anything less than a successful partnership is incredibly disappointing, to say the least. I would like to thank Mayor Scott for his leadership and his tireless advocacy to ensure that our residents get the vaccines that they need.
Thank you, Dr. Gerasa. And lastly, to the governor's comment that we are pointing the finger at him out of frustration, let me be very clear. Neither I nor any of the ever-growing number of government leaders from across this state are pointing the finger at the governor. We're simply asking him to do what governors do, lead. I'm extremely frustrated, and I want to be very clear. This is a conversation that is nothing but a distraction tactic, a Jedi mind trick to cover up the completely inequitable vaccine distribution process that we have. We appreciate the governor's concern for Baltimore City residents, and we hope he will show as much concern in delivering the vaccine as he does his misrepresenting the work the city is doing to rapidly and equitably vaccinate its residents. While the governor continues to go back and forth about petty politics, people are dying from the virus. And our black and brown residents, the same residents who were already facing grave health disparities, who are already dying from this virus at a higher rate, and who have the least access to transit and health care, we understand they are being left behind by this vaccine rollout. And the state has refused to this date to be a true partner and act with us. But we stand ready today to continue and will be here to work with them. I want to be very clear that my responsibility is to the residents of Baltimore. In this moment, that means stepping up and continuing to advocate for a fair and equitable distribution of this vaccine for all Baltimoreans during this unprecedented pandemic. Let's end the discussion on distractions and focus on what is important: vaccinating our residents because their lives are at stake. Thank you.